Hello, everyone. I'd like to ask you to take out a pencil and a piece of paper and number from 1 to 10. We're going to take a quiz today. Hello, everyone. My name is Maureen Williams, and I'm the Director of Care Navigation here at Four Seasons, the Care You Trust, and you've joined Ask a Care Navigator, Mondays with Maureen. We try to create this space on most Mondays to talk about issues associated with living well and aging well, and perhaps how Four Seasons may be of service. If you have any questions or comments about anything that Four Seasons does or that we talk about here in this episode, please call us at 866-466-9734. Or even better, go to our website, which is fourseasonscare.org. And please spell out the number 4, FOURSEASONSCARE.org. There's lots of great information on our website, and there's ways to send in inquiries to find out more about us. Now, I'm so grateful, always so grateful this year to be able to say that we are so thankful to the Van Winkle, the Van Winkle Law Firm for serving as the title sponsor for Ask a Care Navigator, Mondays with Maureen. The Van Winkle Law Firm is one of the most well-established and respected law firms in North Carolina, providing exceptional representation to individuals, families, and businesses in personal, commercial, business, and estate planning matters. I particularly interface with the Van Winkle Law Firm for estate planning matters. Should you want more information or to schedule a consultation, please go to the website www.vwlawfirm.com, www.vwlawfirm.com. And you can get a lot of information there as well. Well, February is Heart Care Month, Cardiac Care Month. So I thought we would do a little quiz. Do you have your paper and pen out ready to go? 10 questions, true or false, very easy. And guess what? You get to grade these yourselves, and it's all going to be just fine. I thought it'd be a little bit fun to kind of review some important matters for heart health in the form of a quiz. So I'll read the statements to you, and you respond true or false, and then I'll go back and give you the answers and why. Okay? Let's have a little bit of fun with this, and let's learn a little bit too as we go along. So the first statement is, the heart is classified as a muscle. True or false? The heart is classified as a muscle. Number 2, true or false? Multiple health conditions can increase your likelihood of developing heart disease. True or false? Multiple heart conditions can increase your likelihood of developing heart disease. Number 3, true or false? Every heart attack starts with intense, sharp pain in the chest. Again, every heart attack starts with intense, sharp pain in the chest. True or false? Number 4, you should immediately call 911 if you notice heart attack warning signs. Again, you should immediately call 911 if you notice heart attack warning signs. Number 5, true or false? Women should be more concerned about breast cancer than cardiovascular disease. True or false? Women should be more concerned about breast cancer than cardiovascular disease. Number 6, true or false? Stopping smoking is among the most beneficial actions for cardiovascular health. True or false? Stopping smoking is among the most beneficial actions for cardiovascular health. Number 7, having relatives with heart disease guarantees you'll have the same level of risk. Having relatives with heart disease guarantees you'll have the same level of risk. Number 8, true or false? Exposure to polluted air can damage your heart. Number 8, exposure to polluted air can damage your heart. Number 9, true or false? Older adults should minimize physical activity to protect their hearts. True or false? Number 9, older adults should minimize physical activity to protect their hearts. And finally, number 10, true or false. Exercise is recommended for someone who has survived a heart attack. Again, exercise is recommended for someone who has survived a heart attack. All right, let's see how you did. Do you have your answers? Okay, let's review them. The first statement, true or false, the heart is classified as a muscle. And the answer to that is true. It's one of the busiest muscles in the human body. It's certainly very industrious, pumping millions of gallons of blood through your bodies throughout your lifetime. Good job. Good job. So yes, true. Number 1 is true. Number 2, multiple health conditions can increase your likelihood of developing heart disease. And that is true. That is very true. Numerous conditions can do that, most notably, and that we hear about more often, elevated blood pressure, hypertension, elevated cholesterol levels, and diabetes can all increase your risk of heart disease. All right, number 3, every heart attack starts with intense, sharp pain in the chest. That is a false statement. They don't usually announce themselves, not all of them. They don't always do that. They may develop gradually with some mild warning signs. And let me read off some of the mild warning signs when you put it all together may become a major issue. Some of those might include pressure or uncomfortable sensations in the chest area. Discomfort radiating to the arms, the neck, the jaw, the back, or even the stomach region. Another one might be difficulty breathing, which is not mild in and of itself, but putting that with some of these other symptoms, maybe a heart attack. And another mild or less common symptom might be an unexplained nausea, lightheadedness, or perspiration. If you just have any of these niggly symptoms, pay attention to them. You might think they're niggly. They might be announcing a really big major event. Pay attention. All right, number 4, the statement is you should immediately dial 911 if you notice heart attack warning signs. And that is absolutely true. True. Modern cardiac care is highly effective, and prompt treatment significantly improves survival rates after a heart attack. And it also reduces long-term complications. If you feel chest discomfort, particularly when combined with any of those other warning signs that I just shared with you, don't hesitate. Call 911 immediately. Better safe than sorry. Okay, statement number 5, true or false, women should be more concerned about breast cancer than cardiovascular disease. It's false. Heart disease claims far more women's lives than breast cancer does every year. It's really sad. Heart disease just doesn't affect men. Heart attacks just don't affect men. They affect women too. In fact, it's the number one, cardiovascular disease is the number 1 killer of women in the United States. And not only that, women face higher mortality rates in the year following a heart attack than men do for some reason. It's serious for everybody. Statement number 6, true or false? Stopping smoking is among the most beneficial actions for cardiovascular health. And that is a true statement. True. Tobacco use ranks among the primary causes and risk factors for developing heart disease. In fact, cigarette smokers face up to 4 times greater risk of heart disease than non-smokers. In fact, people who are exposed to secondhand smoke are 30% more likely to develop heart disease in their lives than non-smokers, just by being exposed to it. Be careful. All right, number 7, having relatives with heart disease guarantee you'll have the same level of risk. True or false? False. Having blood relatives who have heart disease may elevate one's risk. Genetics aren't a done deal. And in fact, adopting healthy lifestyle choices can significantly reduce your vulnerability and risk. Unfortunately, for some individuals, even without risk, being overweight and sedentary can pose greater risks than genetic risks alone. Wow. So what can you do to lower your risk of heart disease? So here we go. Here's some. See I'll show you where I tick off on this. Eliminate tobacco if you smoke. I don't smoke, but if you smoke, eliminate it, please. Work toward reducing blood pressure and cholesterol. I've been very successful at that. Yay, because I do have cardiovascular risk in my family. Incorporate regular physical activity into your routine. Done. There are lots of ways to get started with that. Check with your doctor. It's worth it. Achieve and maintain a healthy body weight. I've lost a lot of weight. I've still got more to go, and I'm feeling much better. And finally, another way to reduce your predisposition toward heart disease is to adhere to your diabetes management plan, if that's applicable to you. That's not to me. Diabetes is a huge risk for cardiovascular disease. It can be controlled. Okay, back to our true-false. Statement 8, exposure to polluted air can damage your heart. And that's a true statement. That's a true statement. Breathing polluted air can trigger inflammation and elevate blood sugar, cholesterol, and blood pressure. Wow. All of those are detrimental to the heart health. Wow. And honestly, if you'd pushed me to answer that, I'm not sure I would have been able to answer that correctly. So, something new. Question number 9, true or false? Older adults should minimize physical activity to protect their hearts. No. That is false. And in fact, as we age, staying physically active becomes even more important to our overall health. Having a sedentary lifestyle can trigger a detrimental cycle of physical deterioration. I've seen it all too many times. If you don't use it, you lose it. And it's harder to regain it the older we get. I speak from experience. Consult your healthcare provider. Get involved with some sort of physical activity. All right, the final one, question number 10. True or false? Exercise is recommended for someone who has survived a heart attack. Yes, true, of course. For most heart attack survivors, recovery and participation in a cardiac rehab program is highly recommended. I've known so many people to successfully complete their cardiac rehab programs. In fact, I've known quite a few people who've said, I feel better than I did before they had a heart attack, so much better. Of course, coordinate exercise routines and collaborate with your healthcare providers about how much you can tolerate. But those cardiac rehab programs are fantastic. So how did you do? Here's the key. True, false, true, false, false, true. It's hard to read backwards. So I hope you did well. I hope you learned a little something. And even if you didn't learn a little something, I hope you got a little pearl of energy in your brain and your body to do something different if you can. Okay? That's what this is about, just increasing awareness. We don't like that cardiovascular disease is a number one killer in this country. It's very preventable and treatable. So have a talk with your healthcare provider and your family. Okay? So I hope you did okay on that, and don't beat yourself up if you missed any. Just, it's an opportunity. All righty. I hope you are doing well otherwise today. And if you have any questions or comments about Four Seasons, please call us at 866-466-9734, or please go to our webpage, which is fourseasonscare.org. Lots of information there. All righty. Join us next Monday for another episode of Ask a Care Navigator, Mondays with Maureen. I'll see you then. Thank you, everyone.